Hello, I'm Stephan Schwartz, and I want to welcome you to Schwartz Report. Today, I want to talk about something that I see going on in the United States that really concerns me. As I've told you before, I'm not interested in political partisanship. What I care about is stuff that can be objectively verified through proper scientific data. And what's going on is what I call the great schism trend. We are reshaping American culture in a way that is not good for us. We are becoming culturally two countries, one Republican red, one Democrat blue. But the problem is they're not equal countries. If you look at the social outcome data, it becomes immediately clear that when you put aside the political partisanship and you just deal with the objectively verifiable social outcome data, Republican governance is always inferior to Democratic governance if fostering well-being is your criterion. And I think it should be. So there are a lot of different ways I could get into this, and I thought about it as I was getting ready to do this podcast. But I've decided to pick three areas because I think they are particularly relevant and because they particularly concern me. So it's healthcare, maternal health care, and child health care. So let me start with overall health care. I'm just going to start by looking at, if you live in a red state or a blue state, what is it like for health care in your state? And what you see, and you can look at this chart that I've got up, you can see that all of the 10 best states are blue states, and all of the 10 worst states are red states. Now that ought to alarm you and ought to concern you. American healthcare in general is not very good. Americans don't seem to realize this, but we rank at the bottom of all the developed nations in terms of the quality of the health care. And at the same time, we are preposterously more expensive than any other country. Not just the drugs, but everything about the healthcare system. So as I say, if you look at this, at the chart, what you see is all the red states are the worst states, and all the blue states are the best states. I mean, that is itself an issue. But I want to focus today on something particular to that, and that is how women and children are being treated, particularly in the red states. Because we have appalling maternal mortality statistics, and they are particularly bad in the red states again. So look at the chart that's come up, and you can see that maternal mortality in the US far outstrips that of any other industrialized nation. I mean, amazing, the richest country in the world, and we have a maternal mortality rate that is just multiple times more than any other developed nation. And what's even worse, if we dig a little deeper, we find out that Black women face 3 times the maternal mortality risk compared to white women. And that shows you that racism is still a major part of the American culture. And you can look at this chart and you can see that not only is this bad, but it's getting worse. Look at where it was in 2018, and now look at where it is in 2020, the last year that I could get of sure data. And going deeper yet, what I find is that post-Dobbs, something very, very pernicious is taking place, because red states are passing these anti-abortion acts, which are resulting in OBGYNs leaving red states to a point where there are now areas where it's almost impossible for a woman to find an OBGYN. And in fact, in some places, you can't even find a hospital to go and deliver your child. In Sandpoint, Idaho, for instance, first, the only hospital in the entire city, it's a city of about 9,000 people, first the hospital said they would no longer do OBGYN. And now the latest results that I see are the OBGYNs are all leaving. So it's a crisis. We are struggling to get access care during and after pregnancies. And as a result, we're seeing a tremendous increase in maternal and infant deaths. So across the United States, what that means is that about 5.6 million women live in counties, American counties, with no access to maternity care. And that's according to the March of Dimes. Far more, 32 million, are at risk of poor health outcomes because of a lack of care options nearby. About a third of the US counties, according to the March of Dimes research, constitute what are called maternal care deserts. Think about that. Richest country in the world, and you have maternal health care worse than developing countries in Africa. The data also shows that there's a strong dichotomy between the red states and the controlled by the Republicans and the blue states controlled by the Democrats. I just don't see how this can possibly keep going on. I mean, if I were a fertile woman and I were pregnant and I was developing some kind of problems in the course of my pregnancy, and I lived in one of these medical deserts, what in the world would I do? Suppose you're a woman and your water breaks at 2 o'clock in the morning. I know that that happens because it happened with the birth of my daughter. And you have to get immediately to the hospital. Well, what happens if you don't have a hospital that's within 150, 200 miles of you? So this is a really difficult situation. More than that, when you, in these red states where you force a woman or a young girl, that's even worse. You know the stories about 10-year-olds who've been raped by somebody and have to, can't get an abortion and have to bear a child. I mean, what does a 10 or 11-year-old girl do when she's a mother? I mean, just think about that. The University of California looked at this, University of California in San Francisco, and they found out that women who can't get the health care that they need, or that who want to terminate a pregnancy for whatever reason, are more likely to experience serious complications from the end of their pregnancy, including eclampsia and death. They're more likely to stay tethered to abusive partners because they have no other option. They're more likely to suffer anxiety and loss of self-esteem in the short term because they're being forced into a life that they don't want. They're less likely to have aspirational life plans for the coming years. They're more likely to experience poor physical health for years after the pregnancy, including chronic pain and gestational hypertension. Being denied an abortion has serious implications also for the children that are born from those unwanted pregnancies, as well as for other children who may be in the family, the siblings. I mean, what happens when you grow up as a child that your mother and father didn't want, or that you have some kind of really serious problem? I grew up with a brother who was severely retarded, autistic, had all kinds of physical problems. And I can tell you that changes your life seriously. So now let me turn to the effects of red states and blue state governance as it pertains to two trends that are shaping the lives of children in those states. Start with just deaths per 1,000 births. These are the figures from the Centers for Disease Control and Prevention and Statistica. So look at this, the 10 best states for infant mortality. That is, they have the lowest mortality. They're all blue. The 10 worst states for infant mortality, they're all red. So what do you see? Again, this business of the creation of two cultures where one culture is supportive of women and the other culture is not supportive of women or children. I just don't understand how this continues and how people can find it okay to live in that sort of situation. Now let me look at child health care. Again, when you put aside all the political bloviation and you just look at the data, this is what you see about child health care. Now look at this chart when it's compared state by state. Once again, what do you see? The best states for children's health care are all blue, and the 10 worst states for children's health care are all red. So what you come away with is, does America really like its children? And if you think about that, and you think about what's going on with children, you realize children are a country's future. So if you aren't paying attention and being supportive of children, what kind of future is a country going to have? So all the best states for child health care are blue, and 9 of the 10 worst states are red. I could take this into several other directions, but I just want to stay focused on this. This issue about child care has all kinds of ramifications. For instance, a child in Texas is 11 times, think about this, 11 times more likely to be physically abused by a family member to the point of hospitalization than a child in Italy. 17 million children in the United States faced hunger, have what sociologists euphemistically call food insecurity. How is it possible that in the richest country in the world, there are millions of children who are not assured of proper nutrition? Why are we letting this happen? And I could pick a dozen other red-blue comparisons, but that's the pattern that I see happening, and this evolving of two cultures in a single country, one of which is measurably inferior. We, as a country, are splitting in two countries, and we need to address this, and it's not getting talked about. It's not getting discussed. You don't hear it. You hear the bits and pieces in media, on television or in print, but I'm talking about really sitting down and beginning to have a discussion about why we are becoming two countries with two different cultures. The Great Schism trend is a kind of culture war. And in fact, I'm beginning to see it as a kind of civil war. And resolving it is going to change America forever. So what are we going to do here? How are you as an individual going to be able to help with this? The answer, I think, is we must each, if we care about children, if we care about women, we have got to make sure that women have the right to control their own body. For instance, what would it be like if they passed a law that all men who rape a child or a woman who then has a child, that they are responsible for the care and well-being financially of that child for the rest of their lives, at least until the child is 18. How would that go down? Or suppose they passed a law that men who were involved in a rape had to be rendered infertile so that they could never have another child. How would that go down with the men? And yet we seem to find, at least for about a third of the country, it seems to be perfectly okay that we control what a woman can do with her body when she gets pregnant. This abortion issue is not really about abortion. It is, I believe, about controlling women. It is an effort to make sure that women are subordinate. And I find this very, very, not only morally wrong, ethically wrong, but just nasty. Now, I want to say finally, to close this, I want to talk a little bit about abortion as abortion. The first thing is, everybody who is against abortion, the presumption is a kind of materialist, physicalist belief that an abortion kills the being that would incarnate through that mother. The science, and nobody ever talks about this science, but the science, and there is quite a lot of it, is telling us that there is a continuity of consciousness. That is, there is an aspect of your consciousness that exists before you incarnate, and that continues when you die. You can look at the reincarnation research, for instance, that tells us, and there are now thousands of these cases that have been studied. You don't hear anybody talking about them, but the research is very clear. There are thousands of these cases where it is children come in and remember past lives. They remember who they were, and when they go to check it out, it turns out that it's true. I'll give you an example of one I personally was involved with. We had a young boy. He was about 6 years old. And he said that he had been, this was in India, he said that he had been a money lender in a previous life in a village that nobody in his village had ever heard of or been to, and that he had was having an affair with a wife of a woodcutter. And one day the woodcutter came back early and found them. And as he was trying to crawl out the window, the woodcutter took his axe and hit him in the back and killed him. And interestingly enough, this child had a scar that ran up his back exactly as you would expect for someone hit by an axe. There are hundreds of examples, for instance, of children who come in with birthmarks or scar tissues that arise from what they say are previous lives. And these things are checked out in meticulous detail. The work being done originally by Ian Stevenson and Jim Tucker now in the University of Virginia, they have been studying this issue for years and have thousands of these cases. And they're not just in countries like India, they're in the United States, all over. So we need to first begin with the proposition that consciousness is causal and fundamental, and that it exists prior to incarnation, and that it continues after death. And interestingly enough, there just was, you saw possibly on the media, CNN, for instance, covered it. There was a paper, a study just published about people who have had near-death experiences where they died medically and yet were resuscitated, and the experiences that they had while they were medically dead, sometimes for several minutes. In fact, in some cases, as long as an hour. So we need to start with the premise that everything that we're doing about the care of children and women has a long-term effect that extends beyond a single lifetime. And that what abortion really is denying a person, denying the eternal self, what religion calls the soul, the ability to incarnate through that particular mother, but doesn't kill the eternal self. It can find an example, it can find another mother through which to incarnate. And in fact, there are examples of that. So we need to begin to think of this as consciousness is primary and causal, and that forcing a woman to become a mother when she either is unequipped to do that, she is too young to do that, is just doing terrible damage and making the life of the person that does incarnate in that way very difficult and unpleasant. How do you bring up a child you didn't want, that you had to bear after you were forcibly raped? Think about that. If you're a man, think about that. I don't think that men are thinking about that. And I don't think that the red states that are governed by Republicans are thinking about that either. We need to take a new look at this. And as an individual, you can become an agent of change by making it clear to your state representative, your state senators, exactly what your feelings are about this issue. Because it's very clear that the anti-abortion people, who are now going to talk about they're the baby protectors. That's the new form they're going to take, because it's clear that the majority of Americans do not support this anti-abortion, forcing women and children to have children that they don't want or are not prepared to deal with or care for. So call up your representative or write them, or your senator. Let them know what your thinking about this is, and that it is important to you, and it's going to affect the way you vote, that they come out in support of a woman's right to make decisions about her body and how she bears children and when she bears children, entirely between her and her husband or partner, her doctor, but that has nothing to do with politics. We need to get birth out of the political business. And we need also to really begin to get serious about caring for children, because children are the country's future. And if we do not help them eat enough, get enough education, I didn't even get into that, but I could have. If we don't do what needs to be done to see that children grow up with the greatest potential opportunities, with proper education, with proper diet, with proper support, then what kind of country are we going to have? What kind of people will Americans become? Who are we? And what are we doing? I think those questions really need to be something that each of us reaches within ourselves and answers. So I leave you with that, and I hope that you will think about this and that you will do what you can to be an agent of change. Thank you.